So maybe we will start. Hello, my name is Mariana Cherkis. I'm delivery director at Agilyway. We are a software development company, and we help clinics, like providers who are working with with healthcare and so on, implement AI solutions, some CRM and other things. So I gathered some sort of like trends what we have nowadays and what we think would be actual in 2026. So I would like to share it with you, and I hope it will be like useful for you. Our agenda, like I will share trends from like backgrounds, AI, forecasting, care, staff, community health, and other things. I will share with you real examples and effects, how it help. Also, we will discuss challenges because this is healthcare sphere. It's the same like finance, so it's a lot of challenges, a lot of scares, things, and fear. So we will discuss this, and I will leave some time for questions. And please, one more time, I just want to tell you, you have chat here, and you can share there your questions and your ideas, what we can discuss during question session. So what about AI and how it used in like nowadays, like previous year? So it's like very popular. It's discussed on all panels. And I think that nowadays we can see the benefits of using AI solutions. If you see here like some statistics, it's based on US clinics, but I'm pretty sure that we have the same things in Europe. And I'm sure that we have the things here, like in Ukraine, let's say. So 71% of big hospitals nowadays at least used one forecasting AI system. And that's like absolutely true. If to talk about some paperwork and other things, large hospitals try to increase usage AI and try to help nurses, doctors to do all paperwork. Over 1,000 AI medical tools approved by FDA. So, and that's very cool things because I know how clinics like afraid of, oh my God, we have some rules, how we need to follow it. So now we have tools that's like already allowed to use by hospitals. Only about 15% have hospital-wide plans for using AI. And that's really very sad statistic. And if to talk about AI, nowadays, like around 16% used for office task and routine work. And it's not, I think, enough, and I hope it would be better, that only 40% used for patient care. I always like patient, and I want that it will be like more proficient here, diagnostic and other stuff. So I really hope the AI will help with this stuff. Okay, let's talk about the trend number one. So that's like background and creative AI becomes the normal way doctors work. So it's like the most popular things nowadays. By 2026, AI that creates things will change from being just helpful to being a basic tool for doctors. For sure, I think that AI should help to like improve this paperwork. It should help doctors feel less stressed. And it's nowadays, I see in many clinics, yes, when you just have visit to the doctor, you just doctor speak you some diagnostic or something other things, and everything just written by AI, and you have summary after this visit to the doctor and so on. So everything could be used with AI, and AI would help with that stuff here. So this is like trend number one, where we can use AI. If to talk about trend number two, I think that you for sure familiar with these things when there are like a lot of data, a lot of tools, yes, that a doctor uses. So, and nowadays AI can help doctors like on early stages understand what's going on with patient, analyze data what they have, like gather all data in one place. So here we have some sort of statistics that we have that sepsis founded 5-6 hours sooner than it was before. We have statistics that 12% fewer patients moved to intensive care. So we see the benefits of using AI in consulting or the patient, about the care about the patient. So we see the statistics that is much better nowadays than it was before. And I hope in this year and next year it would be, the statistic would be better and better in this case. Also, I want to share one thing that like AI can detect, for example, diabetic problems. Yes, and I know that some patients have some sort of like clocks or other stuff where it's like provide on time information for doctors, for clinic about the patient, and it's nowadays it's very popular things, especially for example when we have old people, yes, or we have people that have some problems from day to day, like some like chronic things. So here it would be very, very helpful. If to talk about trend number 3, I think that the main features that now clinics use is we have like different scans, yes, in clinics. We have, for example, a lot of information in CRM system and other things that would be much easier when everything would be in one place. And for sure, here we have when everything to like all information gathered in one place, when AI can automatically analyze this information and help doctors provide like a good diagnostic here, for sure we will have better results. And we have like some statistics during this like investigation. So AI for breast scans helps find cancer about 20% earlier. Yes, there is like much quicker results. Scan doctors finish cases 25, 40 to 40% faster. And for sure, AI for finding problems goes from being just a tool to being a core part of how things work nowadays. And I really happy that doctors are also interested, yes, in using such tools, because this is like additional, like reassuring thing. For example, yes, I have some diagnosis. I have some ideas how to do, like what medicine provide, how to do, for example, help like how help a patient, yes, but when I have helper like AI helper who provide me some ideas, who provide me the solutions how to do it better, and this is the same what I think, so I'm more confident as doctor when I have this like solution on a place. Okay, so and trend number 4 nowadays, it's like our routine. So AI for daily tasks. We know how nurses work from day to day, how doctors work from day to day. There's a lot of stuff what to do. There is a lot of paperwork. There is a lot time takes this day-to-day routine. So there is a lot of problems and a lot of mistakes what we have in hospitals. And how it like what we can do. We can do like automatic handling of, for example, bills. Yes, we can make stuff schedules in a moment based on needs. Yes, we can making, for example, operating room schedules better and faster. Also, AI can forecast what suppliers are needed. Yeah, and for sure, smart ways to move patients smoothly through the hospital. So it's like typical things when we have like optimized our schedule, when we have optimized how many, like for example, places we can have for patients and so on. If to talk about results, so we also have some statistic about this trend and how it's like help nowadays. So there are for sure less mistakes in bills. There are for sure much quicker payments goes to the hospital because we have like no issues in bills, and then many money can be worked around quicker. And for sure, like forecasting staff needs to reduce waste work by up to 10 percentage. So this is like real numbers. So it's not just like something that I hear somewhere. So this is a real number, what we have and what we see nowadays in hospitals when they implement AI solutions. For sure, it's like why like this matters for hospital. It directly, like how it's written here, so it directly makes hospital more profitable. So it's have direct impact on money, and I think in like nowadays each hospital this is like the first thing for what hospital should think about when you are thinking about implementing AI in healthcare, routine work and automate daily tasks and other things. So it should be the first place what to think about where AI can be used. If to talk about trend number 5, it's a little bit related to the previous one, but here more proactive. We have scenario when we base on information what we have about patient, about medicines, what we have in hospital, about everything what we use. Yes, and we can forecast some things. For example, we can forecast for nurses how they, in what order they should visit patients, and plan how it would be like do not like waste their time, how it would be the most optimal based on their medicine, based on their prescription from doctors and other things. Also, we can build, for example, a schedule for doctors. Yes, based on information, urgency things, and other what we have, like from day to day from patients and other things. So this is about planning, where we can optimize planning, where we can as like optimal as possible use time of doctors, nurses, and other staff of clinics. So this is like also one of the most popular trends where we can use AI. There is like no a lot of security risks. This is just from day-to-day routine. One more thing, it's like more complex, where you need to have some data, and this data should be like accurate. So this is use AI for forecasting patient, for example, returns, patient recovery, and other stuff. That may help you like forecasting in these cases. Nowadays it's like very accurate, like over 80% on a common measure. So it's helping patients early cuts down on hospital. And for example, if we have patient that we decided to stay in a hospital, we have in all information about their illness. We know how it's started. We know the recovery period based on like typical things what we have regarding our information. And what AI know about, like for example, about this illness, how typically patient recovery like period and so on. And it also helps doctors. It also helps plan all work around the patient care here. And nowadays, it's like very common things where hospital uses. And for sure, it's also very much like related on money, because every time when patients stay, they keep some like place of someone when this patient, for example, can stay at home. There are like no need day to day, for example, nurse or doctor overview. So this is like save time of doctors and give them possibility to concentrate on like more really needed cases in this. And the last one, this is trend number 7 that I want to share with you. This is like simple virtual hospital models, yes, and sparse space management. It's also a little bit related to the previous one, but like it's not, let's say, like the same. Here we have like, for example, clinic. We have like AI system. We know all information about how much places and space we have in the hospital, and it helps manage this space. It help predict how many, for example, we have like period when can like be some epidemic of flu or something like that, and it can help hospitals predict this situation when this illness, for example, growing, or will be like less ill people in this like period or so on. So it's about that. So it's like more forecasting things. Nowadays, less clinics uses, yes, because most of them faced with previous like problems what I shared. Yes, but I think it's like soon when everything like routine work will be already like automated with AI. This trend would be like the next one. It's like level up uh, stage. What we have like nowadays, how clinics and doctors use AI. So it's like for sure, this is like for notes. This is the most common things. Based on all our like clients, we see that what you when we ask our clients what do you want to do the first, like what's the most painful thing. Oh my gosh, I don't want to write these notes. It's awful. It takes me too much time. So this is like the first and I think the easiest things what to implement. This is automatic notes where AI can do it smoothly, easy, and there is like no any problems to implement it. It's not like it's really very cheap, let's say. And what we have, doctors spend 45% less time reading notes. This is nowadays we have such statistic and it's work. We have that 30% relaxed doctor stress. Yes, because for them, oh my gosh, I need to write some documentation and there indoors we have another patient. I have no time. Doctor can forget to add something, yes, what he'll, for example, discuss with the previous patient and so on. So less stress for them. And for sure, it's like when doctors less stress, it's like bills would be like more accurate here, yeah, because he do not miss anything. And we have the situation when AI helps really very well. This is with notes. The next thing, it's for sure when we have, like for example, we can find sepsis much sooner than it was previously. When we have all the information about, for example, I don't know, blood pressure, other things, all the analysis what patient have, and AI help, for example, emphasize on some situation that something with this, for example, patient not well, and doctor like AI propose, okay, here this patient need care like immediately, yes, and doctor care about immediate patients, urgent situation, and so on. If they're like patient, for example, can wait, so it's not urgency, so it's much easier to manage everything. Also, predicting things. So, for example, where AI can predict hospitals return with language tools. Yes, very accurate predictions. About 11% fewer hospitals returns for long-term patients. So that's what we talked previously about. And AI nowadays very often used for like X-rays and scans reading. It's also because sometimes doctors can like not see or not sure what they see on these scans, let's say, and AI can be like additional, like reassuring for doctors that they are correct or incorrect. Yes, previously I know that doctors just gather it together and discuss some cases, and nowadays AI is like just one more help in this situation. So nowadays we have also statistics that about 20% better at finding cancer, for example, yes, and X-ray doctors get results 25 to 40% faster than it was before. And as I mentioned before, automation hospital work, daily routine. So it's, I think, the first and the main, like, painful thing what we have in hospitals, and it should be automated with AI as soon as possible. So you have here also on the screen some statistics, and it's shown that it for sure should be done. Uh, yeah, I know that everybody talk about AI, and everybody, especially in hospitals, doctors, nurses, IT companies, also afraid of, oh my God, this is healthcare. AI, we think that AI forbid it, or some tools that use AI maybe forbid it, yes, and so on. But nowadays, we have progress, and I'm really happy with that because we have some regulations. We have HIPAA regulations, we have FDA, we have other sort of regulations, and I'm really happy they also like understand need of this of users this AI. Yes, and nowadays we have a lot of tools that already compliance with all these regulations. There are like no big problem to implement it. And I think hospitals just should like think about the most painful thing and just to find like right people who will help them, who will consult them to implement such sort of things. Uh, so this is like, I think there is like no need to afraid of this because there already exists. There is no like any blockers for nowadays. Also, another things what like some sort of fear what we have with our clients from healthcare. Oh my gosh, we have terrible data. Please give us some time. We will try to structure them. We will try to polish them. Let's say, yeah, we will try to do something. Nowadays, AI can help to structure this data. It can help improve this data. So it will help you to build correct information, to correct outputs. Yes, what we have to like have here. So nowadays AI can help with that. Another things also it's like human more behavior. This is like staff afraid of using AI. Sometimes staff like not believe that AI can do something, AI can help with something. There is like no trust But what we recommend often when you try to implement any AI solutions within clinic, within hospital, you need to find like unicorns, let's say, within your staff, people who are really want, who are like challenges. Yes, and these people would be happy to try. These people would be happy to emphasize on really needed things, what should be improved. They would be happy to try and help you implement this within staff and believe other that it would be helpful. So there is like no problems, no deals too much. Everybody can be trained. Yes, just sometimes for someone needs less time, for somebody needs more time, but it can be trained, and there are like no deal with that. And what about like money? Nowadays also like we have some questions. Okay, if we implement this, if it's like it's cost a lot, for example, does this good or bad? If this AI save money or not? Maybe it's better to leave as is, and so on. But what we recommend always start implementing AI in the most painful work. For example, like paperwork, where like less risks, but you will see results like from scratch here. Yeah, and you need to like try, you need to believe in that. Uh, if to like pass forward, there are like three important steps. For sure, you need to think and build AI around the results. So you need to think what you want to improve and match these AI plans across the whole hospital with clear goals, patient results, and it can be trackable. In this case, uh, for sure, people should like feel that AI help, so it should help people and data. So you need to prepare staff for this. You need to teach key people how to work with that, and you need to like prepare day-to-day way to store and manage data, for example, and how to handle and keep advanced AI tools. And the third one, but I think one of the most important, that is ensure that fair AI oversees. So you need to set up AI overseas group with people from different teams to watch over how AI is built and put into use. So this is like three important steps that you need to keep when you want to implement AI within your clinic and just to be successful in this case. Okay, so if to talk like about the main outcomes, what we have here, so for sure, AI will make doctors' decisions better. For sure, it will simplify paperwork. For sure, it will make doctors less stressful. And for sure, it will helpful for doctors, for example, during surgery, it will keep data, patient data more accurate. So there's a lot of benefits. And I think that AI will help with everything. What is the most painful nowadays, you see from day to day as a patient, as doctor, or as nurse. So maybe you have questions. I tried, yeah, I see chat here. Yeah, I have source. I will share it with you. Uh, oh yeah, good morning, Dr. Avinash. So, can you share like where you see AI can help you? It's very interesting to hear like real doctors. Yeah, you can write, I think, here in the chat. your ideas where you see AI can help you. Also, one more interesting theme, I think, if you are subscribed on Agility News, you will see it soon. We want to prepare a webinar about like more technical, about all these fears, what I just shared, especially some security things, where AI, like everybody afraid to use AI for healthcare. So you just need to follow us regarding this. Good. I don't see any other questions. You can put it here. So any ideas, any questions, we will try to answer. Okay. So if there are no questions, so you have our email. You can write it, and we will try to prepare some information for you, especially if it's like some specific things you want to ask regarding AI and healthcare sphere. So we would be happy to consult you. Good, thank you. Have a good day. Bye bye.